excited to have you here. My name is Dylan Younts with Mariner Wealth Advisors. We've got a really great webinar today. Going to be talking about Medicare. We've got Bob Wasky from the Wasky Group joining us today. Bob's got over 30 years of experience within specifically the Medicare sphere. He's a specialist with the Wasky Group. He's got a lot of accolades, a lot of experience. Won't spend a lot of time giving Bob praises here. He's got a lot of wonderful notes on his resume here, but we've asked Bob to come in today to talk to us about Medicare specifics and what to look at and what to consider as you're planning for retirement and Medicare. Really excited for the presentation he has for us today. As always, we're going to have Q&A. I will be monitoring that. We'll do Q&A at the end. And as you have questions, please send them in. We'll take care of that at the end of the webinar today. And with that, Bob, I'll hand the reins over to you.
Thanks, Dylan. I appreciate it. Thanks for the whole Mariner team for setting this up and making it happen. So just full disclosure, I think I made a mistake on my notes to you. 30 years in financial services, the last 9 in the Medicare space. So I started to specialize, I found out about the business about 10 years ago, and I started to build my own practice.
Well, perfect.
So we're Medicare specialists. We help people with anything related to their Medicare questions, when to enroll, how to enroll, all the logistics and timing. And then we're also insurance brokers. So independent insurance brokers, we don't charge a fee, but when you sign up for a supplement, an advantage, or some type of secondary product, we would get paid. No need to do that. Just I have to put that out there as full disclosure again. And the way it works is education session today, all about learning the basics of Medicare. What do you do to avoid mistakes? We're not going to try to make anybody experts here, but we're going to give information, and you're also going to have my information at the end of the session. So you have my email address. My partner Dan and I, we work together. We've got a small team here in New Jersey, but we're national, and we're here to answer anything you need. Okay, so that it's going to be what is Medicare? When do you enroll? That's a key focus area. You don't always turn on Medicare when you're 65. How do you enroll in Medicare? Compliantly, no gaps, no penalties. And how much does it cost? Right? Those are the key components. Then we're going to touch on what are the secondary coverages that will supplement or potentially replace your Medicare benefits. So that's the supplement, the Medigap, Part D prescription plans, and Advantage plans. Those are going to be the different areas. Okay, so with that, I do a lot of these sessions, talk to a lot of people. Here are some of the most common questions. And the answer to virtually all of them is going to be maybe, right? So a lot of it's going to depend on your specific situation. Should you enroll in Medicare if on a company plan? What's the size of the company? How much does the company contribute? Those are some examples. Does the company offer a high deductible plan? Gets into the second question. Can I keep an HSA benefit if I'm 65? Not if you have Medicare. So those are some things. When do you delay? Are you penalized? See, they're all common themes there. How much does it cost? I'm retiring. Do you need a prescription plan? That's important too, because you may not be on any medications. You may leave your company plan, think you don't need a prescription plan. Well, then you're penalized. So we'll get into some of that. Most of this is going to be somewhat targeted, but there will be nuances that are going to be specific to you as an individual. All right, so we'll start with the basic 4 parts of Medicare. 3 are mandatory, required, and 1 is optional. Part A, think of that as you have a Medicare card at some point. There's a Part A, there's a Part B. A is your hospital or the overnight stay at a facility. Think of it as your hotel fee. You stay every night. Parts are going to be covered for free. Parts you're going to pay for. Part B is going to be your providers. All the services that are done by a doctor, medical tests, occupational physical therapy, screening, surgical supplies, durable medical equipment. That's all part of B. Services by a doctor in a hospital, B, because that's not the overnight stay. That's the doctor's services, right? And then everybody needs to have some type of prescription plan after they're 65. It's either going to be through Medicare Part D, or it's going to be through, if you're a veteran, you may have a qualifying program, or you may have a retirement plan. But you need to have continuous coverage, or you're going to be penalized for every month you don't have one. And then if that gray area, optional, that's Medicare C, which is called Medicare Advantage. That's a lot of the commercials you're seeing right now. Now is the open enrollment period to secure those plans. That in this case, I'll get into how you're giving up Medicare traditional to get into these plans. Medicare is paying people to build managed care programs. All right, so this is one of your most important slides. You're going to have a path to go on at some point. The first foundational piece is you have to have Medicare Part A in almost every situation, and you have to have Medicare Part B, unless you're in some specific, federal carve-out programs. But majority of people in the room in the United States are going to have A and B. No cost for A, you pay for B, which I'm going to get into and what that means. So then you have the choice: stay in original Medicare, and what that means is hospital portion, every hospital participates in Medicare. B, 90% nationally, providers participate in Medicare Part B. So the most comprehensive, think of it as your open architecture. Focuses on medical, just like your insurance plan now. It's not going to offer dental. It's not going to offer vision. It's going to offer ophthalmology and the health of your eye, but not glasses, lenses, and frames. So you're going to have the most widely accepted network, right? You're going to have a premium that you're going to pay because you're going to have Medicare A and B. Then you would get what's called a Medicare supplement or Medigap, which pays what Medicare doesn't. So left-hand side, you're going to have A and B. You stay down there. I want to keep traditional Medicare. I couple that with a standalone prescription plan and a standalone Medicare supplement or Medigap, right? And that just real quick on one of the key things here is when you apply for Medicare Part B, you've got a 6-month window afterwards to enroll in one of these Medicare supplement plans with no medical constraints for the first 6 months, right? So this is one of those where you can't just say, I'm healthy now. Let me get the right-hand side, which I'll get into, and I'll go back to the supplement if I have health issues, right? And I want more comprehensive networks. That's a key decision. Doesn't mean one's right or wrong, but that's one of the key decisions you'll be making. So that's the left-hand side. And there are some states, there's 4 or 5 states where there are no medical restrictions, like New York, Connecticut, Massachusetts, a couple where you don't have that constraint of that 6-month window. So the other choice is Medicare Advantage. Those are the ones that are becoming more popular these days, right? One reason they're able to, Medicare now will pay companies to build their own proprietary programs. So now you will have unique company plans, different providers, insurance providers, Aetna, AARP, United Healthcare, Humana, you name it. There's a number of them. They'll have HMO and PPO programs. Those are going to be built specifically based on provider networks that are in your area, services that are covered or not covered. There's going to be, think of it as a more restricted network, more limited, because there's more restrictions as to where you can go and whether someone takes them, right? And there can be more prior authorization required. So it's a little bit more restricted, right? That's a downside. And you also, the other downside is you're going to have, like your plan now, maximum out of pockets that are going to be much higher than the traditional. However, what's the benefit? There's going to be benefits, right? You're going to have other benefits that are going to be a lower premium. That's a benefit. Could be zero. Higher out of pocket, but zero premium. It may have, most will have the prescription plan built in instead of a separate plan. There'll be some dental cleanings in many of the plans, some allowances, some eyeglasses, the vision component, sometimes a pharmacy discount. And I've seen some that have exterminating services. So see, they're taking things away from your core medical services, and they're shifting, they're reallocating resources. No right or wrong. There's no plan that's better or worse. It comes down to what do you feel is best for you when you become an educated consumer. Now, one benefit of the Advantage plans also is if you move into one of these every year in October, there's an open enrollment period. That's why you see all these commercials now, right? That's going to be the case. You either stay with the plan or you move into another plan. You can go back to original Medicare, but you can only get back into the supplement, again, if you can answer health questions. So that's an important consideration. You want to make sure you're happy with what you select initially and be comfortable that you may not be able to go back the other direction, right? You can always go from supplement to or original to Advantage. Again, that's the discussion you'll want to have as you get closer. You want to kind of sort through the different, noise in both directions, right? You want to make sure you do your best choice there. Okay, now we're going to get into, drill deeper into the enrollment periods, right? And this is a key piece, right? Because this is where you can make mistakes. It can be financial mistakes. They can be gaps of coverage where you don't have coverage where you think you do. So everybody who turns 65 is eligible in most cases for Medicare, right? That's your initial enrollment period. So my birthday's in April. If I were turning 65, I'd have January, February, and March where I'm able to apply online, is the way it typically is, and it would be for an April 1st start. So it starts the first of my birth month. Unless my birthday's on the first of a month, then it starts the prior month, right? So you do the A and B if you need it. Why would be examples where you need it? You have individual insurance. You're on a group plan with fewer than 20 employees, right? So in many cases, A and B are going to be required because you have no other option, right? And then if that is the case, one is online, like I said. You can also call the local office. If you do that, you're going to get a 6 weeks waiting period. And then if you're on Social Security, you will automatically get Medicare by default. If you have to have at least Part A, and then you can decide if you want to keep the B. So that's your initial period. Now, in most cases, I'm finding people tend to wait, especially when they're still working. So if you work past age 65, or you have a spouse who's over 65 who's on your plan, or another person, doesn't have to be your spouse, obviously, then there's going to be no option if you work for a small company because Medicare is primary, but assume it's a larger company, more than 20 employees. That's how they define large. Then you can delay both A and B, right? The process I'll get into, how do you apply for A and B? In that case, I'll get into, but you would delay Part A always, even if even if you don't delay Part A, I guess is the best way to say, if you think there's any chance you're going to contribute to a high deductible plan, because if you contribute to a high deductible plan, you can't have A or B, right? So there's going to be different circumstances, again, based on what yours is, whether you're going to apply for A at all, wait for A, wait for B, and that's going to be something we help you sort out. Now, if you work for a large company, you definitely wouldn't want Medicare Part B, because if you're not going to take that health insurance, you're going to keep your company plan, you're not going to go into Medicare, then there's no benefit to signing up for B, right? So sort it out. A, you can have no cost, no penalty, you get Medicare, but if you're on an HSA type plan, you can't contribute anymore, so you wouldn't want A. That's confusing for people. There's no penalty to wait, right? B, you never want to have if you stay on your company plan with more than 20 employees, because it gives you no benefit and it costs you money, right? So that's the second piece. If you want to come off of the company plan while you're working or when you retire, that's when you get your B, and sometimes you get your A also. The general period, that's going to be when you make a mistake, you don't apply under any of these first two periods, you pay a penalty for not having your Medicare Part B, which hopefully nobody gets in that situation. Now, the highlighted areas, again, Medicare is required if you're on COBRA. So Medicare is your primary coverage. It's just like if you had fewer than 20 employees. If you don't have it, then you're not going to get benefits. You're going to pay out of pocket. Again, if you're more than 20 employees, you don't need to apply in Medicare in most every situation. And that HSA piece, the reason I'm hammering that home is there's a lot of confusion about people thinking they'll be penalized if they don't enroll, at least register for Part A, which is not the case. Right, here are the enrollment periods again. Initial enrollment on Social Security, auto enroll, but you have the option to waive the B. Not on Social Security, online, phone appointment, either one of those two. Special enrollment, A would be online or phone appointment. B, there's going to be two forms you fill out. One, your employer fills out a form that says you've had coverage from age 65, protects you from having any penalties. So you're proving you've had coverage, so there's no penalties, no delays. And the Part B application is saying, I want Medicare Part B at a certain time. It can be confusing. It can be, it's overwhelming sometimes because people don't know the steps and the processes. You want to make sure you talk to someone who really understands the steps so you're not in any risk. In this general enrollment period, you just send an application for Part B. Okay, now here's again special enrollment, leaving a group. Again, best practices. So you know that you're leaving your plan. You want to start your Medicare the month after you leave. You don't want to overlap it. If you overlap, there's going to be confusion between the two plans you have in place, between the company plan and the Medicare. And then the second part, you're going to pay for Part B when you don't need it yet. All right. So you don't want to be conservative and not take any chances. You do it with the right timeliness. Right. The Part B application takes time to process. It has to go to Social Security. It takes time for them to process things. Sometimes they're overwhelmed with volume. You typically do it 60 days before you start. That's when they want it. They don't want it to go too far out because then they lose applications. And you check the status periodically. Don't just assume that your application will be approved. Facts might get lost. The document you send might get lost. There may be information that they need. They're not going to proactively reach out to you all the time. Right? If you're applying for Part A, this is an important one that confuses people. You're over 65 years old. Say you want Part A December 1st. You're 68 years old. They'll go back to 6 months prior to when you applied for Part A. All of a sudden, you're going to say, oh, how come it says February? Because they're backdating your Part A. And then we'll help you complete that process if you have any questions, or somebody else can help you. So now we're going to get into how much is Medicare? Right? A lot of people think Medicare is free. You've been paying into Medicare for, if you're 65 years old, probably 50 years. Right? It's been a long time, but you do have to pay. Now for Part B, 90% of the population nationally fall into the first category. Single filer, 103 or less. Joint filer, 206 or lower. Right? And if that is the case, you're going to pay this year, it's 164.90 for Part B. Next year, it's 174.70. And then you're going to have a Part D plan, but it's based on whatever your premium is. There's no cost that you have to pay to Social Security to have it. And if your income's higher, though, you've got 6 other levels. Right? You're going to say if you're between 103 to 129 or 206 to 258 based on your status, you pay extra. That's called IRMA, income related monthly adjustment. So if your income is higher than the base level, depending on your filing status, and this is individual, so 2 filers who file joint, say their income is 350, they're each paying 450 for Part B, and then they have to pay an extra amount just to participate in Part D. They're paying IRMA, income related monthly adjustment. The government's charging you more to participate in Medicare. Right, again, this is confusing for people. If you file in 24, say you retire next year, they're going to look at 22. If you do it this year, 23, they look at 21. Every year, your Medicare Part B premiums or your Medicare premiums are reset. So that's something to be aware of, especially when you're working with your financial advisor. Don't assume there's no cost for Medicare. Don't assume it's going to be that 175. It could be $600 or $700. That's important. Now, another consideration is if you're working, you're a wage earner, you're at a company, say your income is 300, 350. Let's use 350. But husband and wife file joint 350. Go back to 2022 because they retire and they start Medicare in February of 24. It looks like, whoa, I got to pay $500. We have to pay $500 each. Not necessarily. In many cases, you can do an appeal to reduce your Medicare Part B premiums based on a change in life status, reduced hours worked, retirement, other situations like that. So just know that there are opportunities in some cases to appeal your Medicare Part premiums down to a lower amount. Not always, but if you get an amount that says you owe more than the base, call us, call your advisor, follow up on that, because there's a good likelihood that you can do an appeal and reduce it down.
One quick question to hop in here, Bob. We had a number of questions coming in just regarding income. Could you speak to what counts as income
Yeah, it's
How investments are involved with the income calculation process?
in general ways, it's your adjusted gross income. The modified typically get like a muni income would count, is my understanding. And so think of it as your AGI in the tax return. That's in most cases going to be the amount, right? So if you're taking money out of your 401k, that's income, right? If you take money out, so if you take money out to pay for a home, that's going to count as income in that year, right? And that's not an appealable reason to be able to reduce in the future because it's not based on one of those 8 reasons that you can do an appeal for. So it gets tricky. So the note here is in advance, speak to your advisors, learn about the implications. I work with a number of the advisors on the call or on the team at Mariner. That's an important thing that they'll help you with. Right? That's really important.
That's great. Perfect, Bob. Thank you.
Yep. And then, just to recap the 2 options, you've got the left-hand side. You always have your A and your B that you pay for. Either keep original Medicare, get a Medicare supplement or Medigap to pay those gaps in coverage that Medicare doesn't. You get a standalone prescription plan, 25 different plans, typically in most states. They're going to be changing based on the person's medications, the plan structure, the pharmacies they go to, which we'll get into a little bit more detail. Right-hand side, original Medicare. Medicare is paying companies to build managed care programs. You go into a Medicare Advantage program, a PPO or an HMO, and then you're going to have a Part D plan that's typically going to be included in, not always, depends on the plan you choose. Right, so that's going to be your second option. And either way, again, you have to pay those premiums. A lot of people, of clients who we speak to, there's a significant number of people who think that if they get an Advantage plan, they don't pay for Medicare. You're always going to pay for that A, or pay basically for the B, I should say. A is typically free if you've worked at least 40 quarters or you're covered under a spouse who's worked 40 quarters. All right, now we're going to just touch on prescriptions. This gets really confusing. Just know there's a different structure than typically your company plans. Right? So similar in that you have copays based on the category that the medication falls into. A couple more factors though. So first is there's a premium. Every plan has a premium. In 2024, there are plans that have 0 premium. There are plans that have $130 premium. That's the monthly amount that you pay. The premium is a factor, but it's not the only factor. Paying more for a prescription plan doesn't mean you're getting more comprehensive coverage either. We've done probably, since the annual enrollment period started, we review people's prescription plans every year. We've probably done 400 or so by now. And we're finding out that the lower premium plans tend to have better copay structures than the higher premium plans in most cases, or in many cases, I should say, right? One difference is when you have a low premium plan or a mid premium plan, unless you're paying about $80 a month, your plan will be subject to a deductible, which is number 3 here, up to $545. Now, typically that deductible only applies to certain categories of medications though. So see how it starts to get confusing. So tier 1, tier 2, preferred generic, atorvastatin, rosuvastatin, 0, $5, no deductible applies. Tier 3, tier 4, Xarelto, all the commercials you see, Xarelto, Eliquis, you have to reach your deductible. Once you reach that, then the copay structure kicks in, which is a higher copay than the tiers 1 and 2, but it's going to be significant reduction. Xarelto is a $600 medication. It might be on one plan 25% of $600, and another plan it might be $45 of flat cost. And those are all the things that we try to help evaluate. We go into the Medicare.gov site to come out with your best options and make sure it's a highly regarded plan. Some plans have a tier 6, select diabetes. There's controls in place to reduce some of that cost for diabetes medications. That's going to be certain plans and not others. All right, so it gets confusing, right? You look at the bottom here, drug coverage stages. So everything I described was your initial period. You're going to pay a certain amount based on the category that your medication falls into and the copay structure. But once the full retail cost, cumulative over the year, the retail meaning the full cost for that medication, not what you're paying, but the full cost, once that reaches $5,030, every plan is the same, 25%. So if you have two medications at $500 each, you may initially pay $50 each. Okay, but that $1,000 is the trigger. By May, you hit that $5,000 retail cost. Every single plan's the same, 25%. Nope, you can't pay more premium to avoid that donut hole or coverage gap. That's how it is. Now, good news in 24 versus in other years, when you hit what's called catastrophic, that's a next level of expenditure. You're going to pay zero. Where up until, well, this year and any year prior, you pay 5%, which is a lot of money. So if you have a $12,000 medication, which a number of our clients do, by the second month, they're in catastrophic. 5% of a $12,000 medication is a lot. Zero is a lot better. And so there's some controls that the government's putting in place to try to kind of put limits on what consumers pay. And the way the math works out, typically if you're spending up to $3,300 to $3,700 out of pocket, you'll hit that catastrophic and be done. So that's some good news. Again, very confusing, but it's very important to look at these every year or have someone do it for you. So let's get into Medicare Advantage, a little bit more detail. Some of it's repetitive. Private plans, they replace Medicare. HMO is a closed network. PPO has got two tiers, preferred, non-preferred, right? Going to be more limited networks. It's going to be more specific on your geography typically. Again, if you're a snowbird, you typically wouldn't want one of these plans because it's going to cover you more within your local area. They may have some preferred doctors outside of your area, but typically not. Typically, it's going to cost you more or they wouldn't participate. Again, networks, when I say limited, it all depends where you live, right? Low or no premiums, that's important. $0 up to $40. All the newer MA plans tend to be lower cost. The older ones that they keep in place that people don't know to change are expensive, less efficient also. When I say significant out-of-pocket exposure, you're typically going to have a maximum, 6,000 to 7,000 in network, 11,000 to 12,000 out of network. Doesn't mean you'll spend that, but it's like your company plan now. You've got a maximum out of pocket. In many cases, depending on the situation, it could be prior authorization required. There's more discretion because the managed care provider is managing the programs and the costs, right? Their incentive is to be efficient. Good news, they include Part D. They include other limited benefits. Some are valuable to you, some are not. If you're going to go this direction, you want to evaluate which ones are worth it and which ones are not worth it to make a good, strong choice. Coverage is going to vary significantly across plans. I'm in New Jersey. In my zip code or my county, there's probably 35 plans to try to sort out. They're not 35 unique plans. This is the tricky part. They're going to be some subtle differences, right? So you got to try to cut through the marketing. Every year the plans change and you still need B, right? So that's the overview on that part. Supplemental Medigap, very simple. National coverage, all 50 states, it's the same coverage. Get a plan in New Jersey, move to Iowa, move to South Carolina, same benefits. Go visit any of those places, same benefits. They don't change. Every hospital, 90% of your providers. New York City might be 70% of your providers who are at Sloan Kettering that accept Medicare. Some have opted out of insurance. Nothing you can do about that, right? If you had to go to MD Anderson or if you had to go to the Mayo Clinic to have a heart replacement, you're going to pay basically a limited amount. You're going to pay a premium, but your cost for service is going to be controlled, which I get into, right? And they're lifetime and they're portable, like I just said. So they're not going to change. Your premiums are going to go up though. They're going to start at one level and go up as you get older because they're based on your age, right? These are all the plans. They're not all available. Some of them are grandfathered, but it just gives you an idea of it. These are the most popular plans. It's this simple. There's the F and the G. They both give you certainty of costs. The F is the highest premium, but there's no out-of-pocket exposure. All the hospital portion Part A, all the provider portion Part B. As long as it's an approved expense by Medicare, it's going to cover it. The G plan is the other one that gives you certainty, paying a lower premium, say $50 less a month or so, $600 less a year. The only added cost you have is you have to pay your Part B deductible, which this year is $226. Next year it's $240. So I've been talking people out of getting the F plan for 8 years since I've been doing this. Right? The F plan is no longer available if you turn 65 after January of 2020. You're not missing anything. Why? Why would you pay $600 more a year to avoid a deductible of $240, $220? You do the math. I take the money in my pocket, right? So G is your most comprehensive and most cost-effective. The N is another good option. Same exact network, same exact coverage, hospital Part A fully covered. The B, same deductible, $240, $226 this year. It's got 2 extra costs, which are minimal. One is copays of $20 for doctor services. Physical therapy is not a copay because it's not a doctor. It's $20 extra, $50 for emergency room if not admitted. The one thing you do have to watch, which is not real prevalent today, but it could be more future. Fewer than 10% of doctors and or services allowed to be charged more than the Medicare approved amount. If so, under the G and the F, they'll be covered. Under the N, you have to pay 15% above what Medicare allows, then it's covered. So $1,000 that Medicare allows, you don't care what is charged by that provider. It could be $2,000, $10,000. You're on the hook for $150. What the benefit? Lower premium, right? Which we'll get into real quick. So estimating your costs, always pay 0 for A, as long as you've had those 40 quarters. Your B is $164.90, 2023. It's $174.70 next year, right? So that's your basic. You could pay more for B, right? D on average, assume 30, right? So you say New Jersey, female, age 65 as an example, $140 for the Plan G. Plan N, probably $100. So you see a difference in premiums, right? If you're in South Carolina, you're in Georgia, you're in certain states, it might be, for Plan G, $100. Right? So there's going to be differences based on where you live. If you're in New York, it's going to be $280. So you see there's going to be differences. Now, if this were advanced and you're out-of-pocket exposure, $240. That's it. You're covered. That's your medical. Now, if this were Advantage, 0, $174.70, 0 typically for the D, and your Advantage plan is going to vary based on what plan you choose, but typically it's going to be zero to $50 premium, lower premiums, and then your out-of-pocket exposure obviously is going to be different. So just give you an idea of it. Now we're going to wrap up mistakes to avoid, best practices. Just be careful. All the mail that you're going to get when you approach 65 and for the rest of your life thereafter, it's so misleading. The government has been trying to crack down on misleading advertising, but it's so hard. These commercials, everything is going to be free when you read it. Read some correspondence. Just be careful. Try to sort through it. Talk to a credible resource. Go online. If you do that, you try to get information. Your best option is through Medicare.gov or a government site. If you go into one of these companies that are offering information, a lot of times you're just going to get called and hounded by salespeople who are trying to sell you something, right? Be aware again, Medicare with HSA restrictions. Don't get Medicare too early because your friend tells you you're going to get penalized. Know the rules so you're not subject to the penalty, which is really, I got my Medicare, now I can't contribute to my HSA. That's your penalty, right? And again, we're talking about companies with more than 20 employees, right? Part B, don't do it too early. Don't have a gap. Do it at the right time. Part B and IRMA, that appeal is a very powerful tool for a large percentage of people who are subject to it, right? And again, if you're at the 3rd tier or 4th tier, you don't have to get down to that first one. You go one tier down, one tier, lower cost. It could save you $50 to $100 a month per person. Medicare and COBRA, this is really important. I have a number of clients who they get COBRA over age 65. The company says we're going to pay for your COBRA for a year. Example, well, Medicare is primary. Two things. You don't have Medicare, you're not going to be covered for the first 80% that Part B covers, for example. You're not going to be paid for the hospital portion. That's really bad. I have people who've had $40,000, $60,000 bills kicked back. The other is you've only got a certain number of months after you leave your company to have a gap to get Medicare Part B. It's 8 months. You go a year, you're stuck. You can't get Medicare until the following year. And so that's important. Part D, just know you need continuous coverage. You have no medications, you don't want to pay that IRMA penalty, okay. But if you don't have a D plan, you're going to have a lifetime penalty. It's small, but it adds up. And last is, work annual review, be proactive about your Medicare, and then really talk to your financial advisor. How do you build those Medicare costs into your plan? How do you prepare for that Part B premium that could be higher, that he or she will help you manage? When do you take RMDs? When do you convert certain retirement non-qualified funds? Putting money away so that you have the funds to pay for your health insurance, the plan. Very, very important. All right, there's independent resources. Like I said, there's people like me, Medicare broker. Make sure if you're going to work with somebody, make sure they represent multiple insurance carriers. They don't just sell one product, square peg, round hole. Make sure they're independent and they're product agnostic and they're looking out for your best interest. They shouldn't charge a fee. If we provide a service, that's part of that's why you would work with us. But if we sell you a plan, we get paid. It's that simple. You shouldn't pay again. All right, and read reviews, they're helpful. First two resources, Medicare Centers, Medicare and Medicaid. That's how you find out information about your Medicare plan, the premiums you're going to pay. It's a very useful tool. To sign up for Medicare, that's through Social Security. So Medicare and Medicaid to give you information about Medicare, that's after you enroll. To sign up, though, everything is through the Social Security office. Either the national office you call, typically you're going to work with your local office, and they're going to be based on your county you live in. All right, so this is us. Before I do that, I have to show you this disclosure. This is important. Dylan, I don't know if you want to explain. This is just telling people that who you are, who's affiliated with whom, right?
Yeah, that's right. So it's just making sure everyone's aware of the relationships between Mariner and Wasky Group. That's pretty much it, though. It's pretty straightforward disclosure information. We've got some great Q&A here. A lot of questions came through, as I'm sure is not a surprise, Bob. Anything else you want to know before we jump into Q&A?
Yeah, just know that, we're giving you a general overview. I'm throwing a lot of details at you. Just know that if you want to break things down, you want a better understanding, it's much more straightforward. You get me in the morning, I didn't have my 6th cup of coffee, everything's going to be great. Call us, email us. We're here to help you answer questions. It's that easy.
That's perfect. So one question I did see come through is more of a kind of tactics question about chasing down statuses of Plan B additions with Social Security Administration. Any hot tips on that? What's the best way to track down status of applications for Plan A or Plan B?
Yeah, so here's our process, right? Because you can go to anybody. We say, okay, let's help you with the Medicare part. So Part B, so first, you're ready to retire. We send you the forms, which you may or may not have through your company. What's the employer form? Let's review it, make sure they filled it out correctly. So that's done correctly first. What's your Medicare Part B application going to look like? The important thing is you put in the remarks section, please enroll me in Medicare Part B on this date, right? If you're going to send it in 60 days prior, so you send it in November or October to start in January, if you don't state your start date, they'll start you early. So first is make sure what you send them is correct, right? Second then is you're either going to fax the information in. Why do you fax it? Because they require it. If you fax it, they'll have a document. You'll have confirmation you sent it. They'll automatically put it into their system. And this is important. I'll tell you why. Or you go there and drop it off. Speak to somebody. There's an online process also, which you can do. There you kind of lose some control because it goes to a central processing center. So what we do is if you fax it in or you go there, what I like to do is I usually call, there's a national number, you call them at 8 o'clock. When the clock hits 8, I like to check the status with the person on the line because I can't do it without them. You got to check periodically. It's that simple. If you don't check, they're not going to get back to you. Sometimes they never enter the information, they lose it. You check it 3 weeks out after you send the information and you got to follow up. It's the easiest way to do it. And then once we know you're approved, it may take you 4 weeks to get your card. Then there's ways to get your number, in advance. So it's perseverance, but you can't just sign up and forget about it. Sometimes there's other things that you need to follow up on.
Great. That's excellent. Next question is regarding Medicare versus Medicare Advantage. This was a question that came through a number of times in different flavors, but the general question is, what are the primary reasons to sign up for Medicare versus Medicare Advantage? And are there any particular issues or health concerns that should be considered in making that decision?
Well, you're always going to sign up for Medicare, right? So Medicare, then you're going to go think of it original or not. I'll tell you straight out, I tend to direct people more so to the supplement or the original Medicare. Why is that? I know that when you go in that route, your providers are going to be covered if they accept Medicare. If you have to go to that place that you need to see, you're going to be able to go there. That your out-of-pocket exposure is controlled. So those are important factors. And if you need to get back into those plans, you're in there, right? Because you can't get back in if you have to go, if you have a medical issue or you have out-of-pocket expenses. With that said, Advantage plans are becoming more and more popular. One reason is they're more profitable for the insurance companies and brokers get paid more for it. Full disclosure, right? That's important to know. Doesn't mean they're bad. Just know that if you do that route, you have to understand that lower premium could work great depending on where you live. I'm outside of New York area in New Jersey, very densely populated. A lot of the providers participate. If that continues over time, that's great news. Will it continue over time? Who knows? If I'm in South Jersey or other parts, may not be as many providers that participate. So it's just, there's no right or wrong answer, and you gotta, it's too much to try to answer on this call, but there's going to be very, very important distinctions. And that's why you want to talk to both sides, because I may be wrong and someone else can be on this seminar saying another side is preferable.
And that's great context too, being aware of where the broker's incentives lie and how compensation can vary a little bit depending on those choices.
And I'd say from my end, you shouldn't care about that as a consumer. If someone's doing a good job, they're not directed by how they're paid. Some people you don't get paid, some you do, but it all works out because you're trying to help a client make a good choice. But I understand what you're saying, but it's one where that's why you want someone that's going to be, agnostic from what you do. They want just the best for you.
And it's a win-win in that case, is if you're focused on what someone actually needs, they're going to get what they need. Everyone's happy.
There's a lot of good people out there. Yeah.
That's great. And along those same lines, when we're talking about Advantage plans, looking at some of the more overview differences of HMO versus PPO, can you speak to that as far as what those advantages or disadvantages may be between those plans? At a high level, we don't have to dive into too much detail.
Yeah, so simple. The HMO is going to be a closed network, meaning there's certain doctors that provide coverage in that. If you want to go out of network, you can't. So because there's certain doctors that will participate, they're going to be probably lower overall costs when you have a skinnier network of doctors who are going to participate, right? Or hospitals that are going to participate. So that's going to be a main difference. A PPO is going to have more broader acceptance, right? Most of the plans are moving, or majority are moving towards the PPO because more doctors are starting to accept the Medicare Advantage plans than they had, say, 5 years ago. It was Medicare Advantage plans were not real popular. They're getting more popular, more and more popular. So PPO is typically what you would do because you have more of a flexibility as to where you can go. It's important.
That's great. Now, are there any other broad topics or points of interest that you would encourage people to look at? So for example, let me phrase that question a little differently. Where would be good resources to access in order to get into some more of the details where, for example, we're talking about HMOs versus PPOs, good resources to see some of the differences between those, or other broader questions around Medicare, Medicare Advantage, all these different terms. What's a good resource to access that information to learn more?
Mm-hmm. Yeah, one is, Medicare.gov. They've done a better job over the last 3 or 4 years to become more user-friendly. Important. There's still a lot there. I'm not saying don't go online at all to look for things, because there's a lot of really good resources. There's some really good people that spend a lot of money on the sites to do good education. There's videos, there's YouTube, there's all that. There's Medicare for Dummies. They're important. So just try to become more immersed in it. That's always a good thing, right? And then as you learn more, you'll start to put the pieces together. What's important for you? You just don't want to listen to your neighbor who says, I like this plan, it works. Well, that may be because they never went to a doctor, or they're overpaying for something. So you don't know what your situation is versus theirs. Right. So online's got great resources overall. You just don't click on a button and have someone call you and, sell you a bridge in Brooklyn. You don't want that. That's what I mean.
Yeah. And an important note, when we look at Medicare.gov, it's an important .gov is the end, not .com. It's Medicare.gov. That's something we've seen clients run into some questions about. I went to the wrong website. What's going on?
All the time, you can be misled and go right to you can go to a Medicare.com, may have good information, but just know they're people like me who have salespeople. They may be a big call center that's national, that's driving volume. Again, they can have really good information, but don't be misled. You're right. Great point. Same thing with healthcare.gov. You have to wait until you get to like the 8th one to get healthcare.gov, which is for
the actual healthcare.gov.
It's crazy. I know. I don't know how they get away with it, but they do.
And that's a great kind of transition there. That's what we're here for. That's what these webinars are all about, to help educate and to dispel some of the confusion that can be around Medicare and these healthcare decisions as clients transition to retirement. We did have a number of questions that came through about specific circumstances. While we'd love to get into that, that's a little beyond the scope of what we want to do today. Talk to your advisors. I'll remind everybody, all these questions are great to bring to your advisors. We had a lot of questions about, my husband is with such and such company. Here's what they told him to do. Is that right? Should we be doing something else? Talk to your advisors. Get connected with us. Let us talk through that with you, and we connect with firms like the Wasky Group to talk. And actually, at that note, Bob, what would be a good way? I see we've got your contact information, but if someone's asking you directly, what's the best way to get in touch with you to set up a time to meet and to talk through some of these Medicare questions?
Yeah, the way we work is, now's a busy time for everybody because it's the annual enrollment period. We're servicing client needs, so be patient. But if someone emails me, calls me, actually, I was joking with you. I had several people who called me this week who said, "Oh, I missed your education seminar," and I was like, "Oh, I didn't do it yet," because you had sent notices out to people, right? So one emailed me and one called me, and I'm working with them to help them figure out what to do. That's how we work. We're happy to try to answer anything we can. And if you go through your advisor, obviously, they can play triage, and of course, I'd redirect back to them so they can put them into your whole financial picture.
Perfect. Well, that's great. Well, that is all the Q&A we have today. Bob, again, thank you so much, Bob Wasky, the Wasky Group. Thank you for being here today and going through this wonderful presentation. We will be sending out a recording of this to all participants and registered attendees for the webinar today. And again, thank you for your time, and enjoy the rest of your week.
Okay, thanks, everybody. Bye.